Nurse using monitor in operating room. An ICU is a specialized unit of the hospital that provides comprehensive and continuous care for critically ill patients. ICU consists of patients who are either acutely or chronically ill and would require specialized treatment and care. Patients admitting to ICU can be critically ill patients, planned admissions but sudden deterioration of health, following a surgery, or unexpected admissions after a road traffic accident. The main purpose of providing intensive care is health restoration. Some patients stay in for longer duration, until they recover or until they pass on. Critical care nurses working in ICU are given patient assignment based on their competency levels and the acuity of patients. It means that a nurse who is more competent would get a critical patient as an assignment. Working in an ICU can be challenging and stressful at the same time. ICU teams are multidisciplinary, consisting of critical care nurses, doctors and specialists, dietitian, physiotherapist, pharmacist, technicians, trained to provide care to the patients. The whole team works in coordination with each other. Specialities in ICU. There are many specialities within ICU that you should be knowing. These include 1. Cardiac ICU 2. Neurology ICU 3. Trauma ICU 4. Burn ICU 5. Pediatric ICU 6. Neonatal ICU 7. Medical ICU 8. Transplant ICU, kidney, liver, heart 9. COVID ICU 10. Surgical ICU. Roles and responsibilities of an ICU nurse. Critical care nurses need to be well equipped with proper training to handle patients more appropriately. ICU is a battleground for life and death, so the nurses are expected to come prepared. A lot depends upon the choices they make and the decisions they take. Therefore, nurses needs to be accountable regarding their patients. In case you make up your mind to work in an ICU, these are some of the responsibilities you will be expected to perform. 1. Monitoring, recording and reporting of the vital signs of critically ill patients. 2. Routine head-to-toe assessment and documentation. 3. Administering of medications and fluids as per doctor's instructions. 4. Monitoring of patients' intake and output. 5. Sample collection and sending routine investigations. 6. Monitoring diet and nutritional needs of the patients. 7. Prevention of pressure ulcers and proper care of wounds. 8. Proper storage and utilization of ICU equipment and devices. 9. Assisting in bedside procedures with the doctors. 10. Identifying patients at risk for complications. 11. Following patient treatment plan. 12. Consultation and coordination with other healthcare team members. 13. Handling and managing code blue status. 14. Caring of pre- and post-operative patients. 15. Performing and providing BLS and ACLS protocols. 16. Assessment of patient and family needs. 17. Education and counseling to the family. Qualities of an ICU nurse. Critical care nurses are specially trained to care for the patients admitted in an ICU. They usually require higher level of competency in comparison to nurses working in other areas of the hospital. Nurse making comfortable to mother in ICU. ICU nurses needs to be proficient in a wide variety of procedures, especially advanced nursing skills. Intensive monitoring and close observations are the prerequisites of ICU patients. Even though the nurse-patient ratio is usually 1:1 or 1:2, still it can be stressful being an ICU nurse. ICU nurses needs to be specialized in the following skills. 1. Strategic planning in delivery of routine care. 2. Organization of work. 3. Time management. 4. Close observation and monitoring. 5. Ability to identify complications in the early stage itself. 6. Dedication to acquire new advanced skills. 7. Critical thinking. 8. Excellent communication skills. 9. Coordination with other members of the team. 10. quick decision-making skills. 11. Compassionate and empathize with patients and family. 12. Certifications such as BLS/ACLS/ critical care nursing. Challenges of an ICU nurse. As discussed earlier, working in an ICU can be challenging and stressful at the same time. The nursing care provided to the patients contributes a lot towards the improvement or deterioration of the patient's condition. ICU nurses are required to remain completely focused throughout their shift and thus ensure patient safety. Since the nature of work in the ICUs can be complex and demanding, it may leave the nurse fatigued most often. Nurses putting in so much physical efforts at work can experience burnouts as well. Exhaustion, irritability and loss of job interests are some symptoms of nurses' burnout. Rewards of being an ICU nurse. Although there may be a significant number of challenges faced by the critical care nurses, it's always a rewarding experience to see your patient improve and being moved out of the ICU. Critical care nurses are considered to be highly competent when compared to other nurses of the hospital. Constant learning, developing interpersonal relationships with patients, impressive levels of patients' accountability and career growth opportunities are some of the advantages of being an ICU nurse. There is no doubt about the fact that ICU nurses are always high in demand. One of the vital elements when looking out for career growth and opportunity is your level of experience. Critical care nurses need to set a benchmark of minimum of 5 years. Once you smash that 5-year mark, you will have the experience desired to be a viable contender for other positions and you'll be considered seasoned. Meanwhile, you may also continue to resume your education and certification programs. In-service sessions, continue nursing education and certification programs helps in building up competence, self-confidence and upgradation of knowledge. With experience, good performance, and continuous education, you can move to other settings or may uphold more responsible positions.